Hi, I'm Colin Hung with Healthcare IT Today, where we explore the latest technology trends in health IT. Today I'm sitting down with Stephanie from the City of Tempe, Arizona. Stephanie, welcome to the program.
Thank you.
I'm really excited to sit down with you because we're going to be talking about how you're using wastewater monitoring for COVID and even before that, the opioids. But let's talk about the COVID stuff first. Tell me how you've been using that.
So our wastewater data for COVID has actually been one of the key indicators that we have in the city as we've been just monitoring the presence of COVID in the community and making decisions about, mask mandates, when programs were going to be available or paused, when, government facilities were going to be open or closed. And so we use the wastewater data combined with data from the Department of Health related to percent positive cases per 100,000, and then vaccination data to assess, how things are going. The interesting thing with COVID wastewater data is that it's a leading indicator.
Right.
And so we would see the numbers in the wastewater go up prior to seeing the numbers from the county go up. So it gave us, a little time to prepare for what we were going to be seeing next.
So, and then once you saw those numbers, who were the consumers of that data? Was it internal departments at the city? Was it the public?
Both.
Both.
And so I am a big proponent of open data, and unless there's a reason to not share it, if the city is using it to make decisions, we should be willing to share it with the public. And obviously we can't do that with everything.
Sure.
But this was something that is of interest to everybody.
Right.
You're asking the community to make informed decisions related to their health, thinking about the health of everyone else around them. You're making changes that actually impact people. So, you're stopping programs that maybe kids might be going to. And so we don't want to make those decisions in a vacuum.
Right.
And so if there's core data that we're using to inform that, we want to be able to share that with other people. One, so they understand that we're not just, deciding stuff on the fly with no data to back it up,
Right.
But so that they can use it to inform their own understanding of what's going on. So it was used everywhere from leadership to the department level out to the community level.
And you were doing this kind of monitoring even before the pandemic started. You were doing it though back then for opioids.
Yes.
Is that right?
Yeah. And that was exciting. Rolf Halden from ASU's Biodesign Institute actually approached the city after we had released our emergency response data related to probable opioid overdose calls. We had published that data public facing and had done a lot of community outreach, just explaining what the data showed, why we were putting it out, how we wanted people to use it, how we were using it. And he saw that, and so he approached us to ask if we'd be interested in piloting a program, not only to just test the wastewater data, but to see if we would be willing to actually use it as part of what we were doing. And we had a lot of internal conversations about that and, whether it would be something that we could actually leverage in any sort of decisions related to this. And so our fire department, our fire medical rescue department, they are very data driven. They are very open to trying new things. And so when they saw the potential for the type of data we could get, they were on board very quickly.
Nice.
And so it was something where once we decided it, Rosa Chowsky, who's at the time was the director of strategic management and diversity, and Rolf went to our city council that was doing a one-time innovation grant fund.
Okay.
Applied for funding to pay for part of it, got the funding, and we launched the program as a pilot.
And so you took that foundation and applied it to COVID, when the pandemic hit.
We transitioned very quickly. So when Rolf came to us and told us that, asked if we wanted to try to test for COVID, we tried one collection area just to see what the results looked like. And once we realized they could actually pick up what they were looking for,
Right.
We quickly transitioned from opioids to COVID. That at that time, it was a kind of capacity issue of
Sure.
trying to do both just wasn't feasible.
Right.
And so we've really been focused on COVID now, but our goal is to make sure we bring the opioids back online and then look at other indicators as well.
Now, before we got on air, you were telling me about this very intriguing program, 20-Minute City, you
Yes.
called it, and you're using GIS to improve a lot of things related to environmental health
Yes.
of the city. Talk to me about that.
So 20-Minute City basically is a city goal where people would be able to access things like fresh food, parks, other types of recreational resources, and kind of daily necessities within 20 minutes by biking, walking, transit.
Okay.
And so there's a lot of things that come into play for that because we live in Phoenix. And there are days when it's 118 outside.
Right.
Or, you have multiple days in a row where it's 115. And asking anyone to walk, bike, or wait outside to get on transit is just not feasible.
Sure.
And so, with 20-Minute City, we have to consider things like, shade canopy. And are there places that people can go to walk that are going to be shaded? Do we have paths that keep them off arterial streets that have really high volumes of traffic? So not only are you risking walking next to cars or biking next to cars, which people don't want to do with little kids.
Right.
You're driving next to pollution. And,
Right.
we're saying, get outside. It's good for you, get some exercise, but go drive, walk right near some exhaust. It'll be great. So, looking at multi-use paths, bike lanes, all those types of things. It's very data intensive, and without having some way to visualize that and then do that type of analysis to look for areas where there are gaps in coverage, there would be no real way to actually do that type of collaborative work.
And I'm assuming the hope is just in general to keep the citizens and keep the people living there more healthy.
Yes.
With all of the canopy and the access to exercise, and you even mentioned access to fresh food.
Yes, definitely. We understand that idea of food deserts and that it is hard sometimes for people who either are choosing not to have a car or just can't have a car for some reason to be able to make it somewhere to get food. And even though rideshare makes it a little bit gives some options for being able to have a car to get someplace, it's also expensive.
Sure.
And so not everyone has that as an opportunity to get that. And so making sure that people have reasonable access to fresh, healthy foods is really important.
What advice would you give to someone who is maybe at another city and just sort of starting their GIS journey and maybe running into some resistance internally? What advice would you give them in terms of the journey you've been through?
Be willing to be persistent and a little annoying. I am both. So I spent probably the first year and a half just talking to people and making the rounds and repeating conversations till I found someone who was like, sure, online GIS sounds fun. Why don't we try that? And we made one app for them and we used them as our success story. We took him from hours of time that he would spend trying to get his data created and published and online to it was under 5 minutes.
Wow, amazing.
And it's just such a time improvement, but you have to find that first success and then get them to basically go out and evangelize about how powerful it is. And so we just kept chipping away. It probably took 3 years of me just having to constantly talk to people until we had more than just like a few departments who realized that it was helpful. So we were basically just working for them until other departments were like, oh, wait a minute. This looks like it could be useful. Maybe we should, reach out
Get
and
on board.
talk it to. Yeah.
Nice. That is fantastic advice. So be persistent and push your way through.
Yes.
And make a lot of friends along the way, right?
Yes, definitely. And be willing to help people. I mean, that was the thing that I always talked about is even, people don't know what they don't know. And the more you know about what they do, the more you can make suggestions to them. Expecting people to come to you and just say, I want this, isn't feasible for people who have never heard of GIS before.
So what you were saying is basically make friends, be persistent, and push through. And that's a great way to get GIS kind of started in your organization.
Definitely. Listening to people and really trying to understand their pain points and being willing to talk to them about, and I can't believe I'm saying this as a GIS person, but non-spatial data, because there are GIS tools that we use where The only spatial data is like showing what the zip codes look like. But
Right.
other than that, we're not doing anything GIS related, but the platform is still helpful. And so, we've talked to people about that and provided them with, dashboards that had nothing to do with spatial data, but it still addressed a need. And once they saw how easy it is, they then are willing to come back and ask for more help as they start to see kind of projects that where GIS could be leveraged.
Amazing, amazing. Stephanie, well, thank you for sharing all this great information with us today. It's been wonderful having you on the program.
Thank you. It was fun to talk about.
If you enjoyed this interview as much as I did, we'd love for you to mash that like button or subscribe wherever you're listening and watching this program. Also, head on over to healthcareittoday.com to get the latest industry news and insights. I'm Colin Hung with Healthcare IT Today. Thanks for watching.